Well, thousands of women are suing companies that make and market chemical hair relaxers, claiming these products led to cancer. It's an issue we're covering with our sister stations across the country in a series we call Damage Control.
This afternoon, investigative reporter Morgan Young walks us through the scientific studies that sounded the alarm and why one major beauty brand says it's not to blame.
In October of 2022, the National Institute of Health published this research called the Sister Study. Researchers follow nearly 34,000 women of different races for almost 11 years. They found that women who used chemical hair relaxers more than 4 times per year were more than twice as likely to develop uterine cancer than women who never used them. Critics complained the women weren't studied long enough and researchers weren't specific about which products are in question. But another group was also paying attention.
Seeing that paper and their results did really spark us to look at this more closely in our population.
Dr. Kimberly Bertrand is an epidemiologist at Boston University School of Medicine. She is also the co-researcher for the Black Women's Health Study. Bertrand's team studied almost 45,000 women, exclusively Black women, for more than 20 years, twice as long as that first study.
We wanted to understand whether women who had a history of using chemical hair relaxers had a higher risk of developing uterine cancer compared to women who didn't.
Uterine cancer disproportionately impacts Black women, and the purpose of this study and others like it is to help determine why.
One of those exposures potentially is chemical hair relaxers because these are products that are heavily marketed to Black women.
How would you explain what you found?
Among postmenopausal women, those who used chemical hair relaxers for many, many years or many times per year had about a 60% increased risk of developing uterine cancer compared to those who never used chemical hair relaxers or who used them only occasionally.
Their findings were published in October of 2023, nearly a year after the sister study was published. But Bertrand says the question at hand was not new.
As early as 1997 is when we first started asking about women's experience with using chemical hair relaxers. Even at that time, it was very clear that there are potential toxic chemicals included in these types of products.
Chemicals like parabens and phthalates, which are considered to be endocrine disruptors, meaning they can interfere with hormones, potentially leading to health problems.
We've published and found associations between use of chemical hair relaxers and uterine fibroids. We've seen modest associations for breast cancer.
Another major criticism of these studies is that they don't specifically name an ingredient in hair relaxer products that are in question. But Bertrand says there is a reason for that.
Women don't always know what's in these products. They're minimally regulated by the FDA. On the ingredient label, it may just say fragrance or preservative, and you don't necessarily know what you're being exposed to.
While different relaxers have different ingredients, nearly all of them include fragrance or parfum, which have their own ingredients that the FDA does not require manufacturers to list. And many studies have already found fragrance to be an endocrine disruptor.
So I think women have a right to know what they're exposed to and whether there's potential toxicity to the chemicals they're exposed to.
And as women started to hear about the science, they also started to sue.
We immediately started looking into it.
Brooke Cohen is a partner with Cohen Hirsch, a law firm with offices in Dallas and Atlanta that is representing about 100 women who are currently suing hair relaxer companies.
Anytime there's a product that harms women, it's something that we think is so important to get behind because there has to be change.
The firm is one of many with cases all over the country. In February of 2023, just months after that initial sister study, what's called a multi-district litigation, or MDL, was formed in a federal court in Illinois to handle the more than 50 lawsuits that had been filed at that time.
If a person went up against Revlon or L'Oreal on their own, it would be so prohibitively expensive for that person that they would not be able to probably win. It's a David and Goliath situation, really. So in an MDL, all of the discovery, the fact-finding, the evidence is shared across the plaintiffs across the nation, and those costs are shared.
At the end of February of this year, 2 years after the MDL was formed, there have been more than 9,800 cases filed. There are a number of hair relaxer companies and manufacturers listed as defendants in these cases, but the biggest one is L'Oreal. The company distributes both at-home relaxer products and professional-grade products for stylists under its Soft Sheen Carson brand. In a statement, the company said in part, "Our highest priority is the health and well-being of all our customers. Our products are subject to a rigorous scientific evaluation of their safety by experts who also ensure that we strictly follow all regulations in every market in which we operate." It goes on to say, while we understand the desire of each plaintiff to find answers to and relief from their personal health concerns, we are confident in the safety of Soft Sheen Carson's products and believe the allegations made in these lawsuits have neither legal nor scientific merit. It also points out the initial sister study stated there would need to be further research to actually determine whether products cause the conditions in question.
There are also limitations to epidemiologic studies. That's maybe what the manufacturers in these lawsuits are sort of hanging on. The biggest thing that could be done immediately is like transparency on like ingredient labels, manufacturers being required to actually list what the ingredients are, and then women will know, what they're being exposed to.